Children with medical complexity spend a lot of time at the hospital. When they are ready to go home, parents can often have a sense of excitement, but also apprehension. They are home as a family, but also fear leaving the safety net their hospital and medical care team provides. This video will explain how Project Austin works through a patient's journey.
So what do I do if she has a medical emergency at home?
I understand your apprehension, but we have a program at Children's called Project Austin, which extends the healthcare team to your local EMS and emergency department. We'll work together to create an emergency medical plan that can be activated if she has an emergency while at home.
The Project Austin team works with the patient's family, healthcare team, local EMS, and emergency department to create an emergency plan unique to the patient's diagnosis, medical needs, medical technology, and equipment.
The first thing that we want to do is just really to get to know Briar. So how does she typically communicate?
Yeah, so she does a lot of hand gestures and facial expressions. She's nonverbal, but you can tell if she's uncomfortable because she'll show you in her face.
The Project Austin team collaborates with the patient's local EMS and emergency department to prepare for an emergency. Education is specific to each Project Austin patient who resides in the area and is completed on site. Focus is placed on defining roles within the scope of practice and devising an action plan using available community resources. A collaborative approach embracing the one team, one purpose philosophy is imperative. Children with medical complexity thrive at home, but are prone to unavoidable medical emergencies. Preparation for these medical emergencies is important to provide the right information with the right know-how, to provide the right care at the right time. These three components improve the quality of care, resulting in positive outcomes. The following is a mock 911 call to illustrate the Project Austin Emergency Medical Plan in action.
911, do you need fire, medical, or police?
I need medical.
Can you provide me your location?
I'm at 123 Apple Street.
What is your emergency?
My daughter is a Project Austin patient. Her name's Briar. She's having a seizure and is having a hard time breathing right now.
I see her information in the system. I am sending EMS right away.
Hi, so we looked at Briar's emergency medical plan on the way here. Can you tell me how she's doing?
Yeah, so she started seizing about 10 minutes ago, so I gave her rescue medication at home. After I did that, she continued to seize. She's starting to have shallow breathing, and her oxygen started to decrease.
I'm just going to double check her emergency medical plan, but it looks like the next step is to give her another dose of her seizure rescue med, so I'll go ahead and draw that up and give it.
Okay, thank you.
Okay.
Holly EMS to dispatch.
Dispatch, go ahead.
Holly EMS service en route to Holly County Hospital. We have a Project Austin patient, Briar, currently seizing with the parent on board, and we are code 3. ETA is about 5 minutes.
So this is Briar. She's a Project Austin patient. She was at home, started seizing. Mom gave her rescue medication and called 911. So we responded when we got to her. She was still seizing, so we followed her emergency medical plan and gave her another seizure rescue med about 5 minutes ago. She's been on oxygen, otherwise vital signs have been stable. Any questions?
No, thank you. Sadie, I see that Briar still has some deviated eyes. It's been about 5 minutes since the last dose of her seizure medication. It looks like according to her emergency medical plan, the next dose is for phenobarb. We're going to give that medication now. There's a chance that she may stop breathing, so we'll be prepared if that happens. Our doctor is also going to call her neurologist at Children's so we can transfer her there, since we've given 3 medications now and that's the next step in her plan. Do you have any questions for me, Mom?
No, thank you. As a parent of a medically complex child, I have had to take on the role of her medical provider many times. Project Austin has given me the freedom to just be her mom. The first time the fire department came to my home after she was enrolled in Project Austin, I had an overwhelming sense of relief when I handed them her emergency medical plan. I was able to hold her hand and cheer her on in the back of the ambulance while the paramedics tended to her medical needs. They had everything they needed to do, what needed to be done in the moment, and I was able to do what I needed to do as her mother. Truly a moment of beauty.